Good morning. Today we have another combination patient. We're doing rhinoplasty and fat grafting. So I will be starting with fat grafting to our patient because I like to have the face untouched. Because whenever you do something in the face, a rhinoplasty, a temporal or a mid-facelift, you're going to have swelling, edema, bruising, both in the operation area and the neighboring areas, which is going to be harder for us to assess the face's proportions, and we might do less or too much fat grafting to the areas that we want. So the first step is giving tumescence solution for the liposuction. This is our cannula that we use to give the fluids. So it's motorized. So when I push it, it gives the water, and we start by injecting the fluid to the desired area. I will not be doing any laser on this patient because this is just a fat grafting patient, which we will only take the amount that we need, which for this patient I was planning about using 60 cc's of fat, and to do that I will probably have to have like 300 to 400 cc's of liposuction aspirate, which then we will filter out and then only take the fat part and then fraction it, which I will show you in a second. Thank you. And we have started doing the liposuction. We are doing liposuction on the abdominal area, the tummy area. We are collecting the fat in a sterile fashion, so no areas touching the fat. We're just collecting it to the canister, which has been sterilized. So we will be collecting about maybe 300-400 cc's, maybe half a liter of lipoaspirate, and then we will filter it out, and I will show you that in our next section. Thank you. So we have separated the fat from our lipoaspirate, and here you see it. We just put it in our 20 cc injector, and here is the apparatus that we use to fraction. So basically, this is making the fat into smaller particles. We are using 1.4 millimeter to fraction it, and the way we do it is we just pass this through the injectors 30 to 50 times, depending on what kind of a fat consistency that we want. And after we prepare all of our fat, we are ready to inject. Come on. And here you can see me giving the fat to the infraorbital area and also the malar and temporal areas. Our aim here is to give volume, and we give the fat in many layers, making a mash of fat. So it's not just a bolus of fat, different from just ordinary fillers, but we have the fat, alive cells, filling up the space layer by layer, forming a 3D structure to give volume and structure. We are filling the infraorbital area and filling the tear trough deformity and giving a more prominent cheekbone. We also have other areas planned for this patient: cheeks, jawlines, and nasolabial and marionette folds. And this could change depending on the patient, and we can decide upon how much volume we can give to you or which areas to address to. So it's very patient specific, and we always talk and decide before the surgery on what to do for you. Thank you for watching.